Good morning, everyone. I am Dr. Varsha Priyadashni Raut, working as a project officer in HRIDAY, which is a civil society organization working on NCD prevention and control. And HRIDAY acts as a secretariat for Healthy India Alliance. On behalf of Healthy India Alliance and CIPER, I welcome you all to this meeting. We will be sharing experiences and learnings from integrated digital approach for prevention and control of non-communicable diseases in Himachal Pradesh. I would like to introduce our first speaker, Dr. Rakesh Gupta, sir. Sir, can you please move the slide ahead? Thank you. Dr. Gupta is President and Director of Strategic Institute for Public Health Education and Research, CIPER. He is the former Director Health Services and Director of Chemical Examiner Lab, Punjab. Dr. Gupta is an alumni of Johns Hopkins School of Public Health, Baltimore, and University of California, San Francisco. I request Dr. Gupta to please deliver the welcome address. Thank you, sir.
So thank you, Barsa. So I welcome you all to this dissemination workshop. So Nadeep, can you move the slide? Yeah. And this is a very important workshop because we want to disseminate the good work done by Dr. Gopal Chauhan as SP NCD. And HP is in fact leading all the states. So on behalf of Strategic Institute of Public Health Education Research and Healthy India Alliance, I welcome our guests of honor, Dr. Anita Mahajan, she's a DHS HP, Dr. Monica Arora, she's Executive Director, HRIDAY India, and maybe MD sir also joins. He's MD NHM, Mr. Berwa. He is still not joined, but he is likely to join. And our subject experts, Professor Dr. Sonu Goel, he's from Department of Community Medicine, School of Public Health, PGIMER, Chandigarh. And also he's the Director of ERCTC. So we also have with us Dr. Rana Jaisingh, Deputy Regional Director, Union Southeast Asia. And the keynote speaker for today will be Dr. Gopal Chauhan. He's SP NCD and Palliative Care for Himachal Pradesh. And Dr. Radhika Srivastava, she's from HRIDAY. And I also welcome all the participants from Working Group of the NCDs Punjab, members of the Healthy India Alliance, members of the TC Alliance Group, Dr. Shikha Basin, Dr. Barsad, Mr. Nardeep, he is a technical lead with CIPER. So, and all those participants who have joined for this virtual experience sharing integrated digital approach for prevention and control of NCDs in Himachal Pradesh. So I'll now request Dr. Barsa to invite Ms. Radhika Srivastava. She'll talk about the working group on NCDs in Punjab. Thank you, Barsa.
Thank you, sir. So please move the slide ahead. Thank you. Ms. Radhika Srivastava is Senior Director of HRIDAY. She is leading the Secretariat of Healthy India Alliance, which is the Indian NCD Alliance that fosters engagement of multi-sectoral CSOs to address NCDs through meaningful engagement of CSOs, people living with NCDs, and young people. Ms. Srivastava has 2 master's degree in nutrition and public health. Ms. Srivastava will be speaking about the multi-stakeholder working group on NCDs and UHC formed in Punjab by collaborative efforts of Healthy India Alliance and CIPER. Ma'am, please.
Thank you so much, Barsa, and thank you, Dr. Rakesh Gupta, for organizing this very important meeting in collaboration with the Healthy India Alliance. My colleague, Dr. Monica Arora, will be talking much in detail about the broader activities of the Healthy India Alliance during her talk, but I will restrict myself here to talking about the work that the Healthy India Alliance and CIPER and HRIDAY have been undertaking in Punjab since the last few months, since the beginning of this year. Just to give you a very brief introduction about the Healthy India Alliance, it is a coalition of 24 member organizations, which you can see the list on your screens. CIPER is one of our new organizations, and the coalition's vision is to catalyze multi-sectoral action to enhance health and quality of life in India. Our mission is to create an enabling environment for active participation of health and non-health CSOs to prevent and control NCDs through effective policies, partnerships, and programs. Next, please. So concentrating on the work in Punjab, next please. When we started our activities right in the middle of the pandemic, where across the country we were all grappling with not only just the health, but physical health, but the mental, social and economic burden of the pandemic. And that is the time when Healthy India Alliance was already very active in the area of engaging people living with NCDs. But we realized that the pandemic was an opportunity to really bring to the forefront not only the challenges and priorities that people who live with NCDs face, but also position them as important stakeholders, not just in a public health emergency response, but also as key stakeholders in routine response to NCDs, whether it be as in activities which are related to health promotion or activities which may be related to screening, etc. So we started off with a first virtual consultation on previous slide, please. Yeah, so we started on with this virtual consultation on access to quality healthcare and telemedicine services during COVID in Punjab. This is something we organized in February 2002, which was a group of civil society partners, medical fraternity, government representatives, and people living with NCDs from the state of Punjab, really talking about their perspectives in terms of what are the challenges that they face in terms of coping with the pandemic, and how the experiences of people living with NCDs can be channelized to assist the medical fraternity, to assist the government in a more robust response to the COVID pandemic. Next, please. So these were the thematic areas in which the group had discussions. It included, again, what are the challenges and opportunities in harnessing telemedicine services? What are the experiences of accessing healthcare and self-management of NCDs? Lessons learned from virtual and in-person healthcare delivery for NCDs, and the role of CSOs in enhancing meaningful involvement of people living with NCDs. All these in the context of the not just the pandemic, but even looking beyond. Next, please. The discussions of this consultation were captured in one of its kind report, which was developed by Cypher and the Healthy India Alliance, which was accessing digital healthcare services during the pandemic in India. This is now a resource which has also been shared with the government of Punjab, and it is available on the Healthy India website. So if anybody would like to access that, and I'll request my colleague Barsa to give the link of this report from the Healthy India Alliance website in the chat, so that you all can go through it in detail in your free time. Next, please. So, this was a very comprehensive report, and I'll just very briefly touch upon what were the main recommendations from this report and contextualize the creation of this working group in Punjab. So the key pointers that we culled out from the discussions were that there is a need for capacity building of people living with NCDs at the subnational level. There was a very strong need and demand felt for a state-level multi-sectoral working group, which comprises of people living with NCDs, CSOs, doctors, academia, and representatives from the government of Punjab. Development of state-level guidelines for meaningful involvement of people living with NCDs and CSOs. Again, this is work in progress, and I'll be speaking about this briefly. Technology to be an integral part of current and future health system strengthening, and the need for it to be tapped appropriately. So again, something which is very relevant to the discussion that we are having here today, where in Punjab, there is an appetite among this working group to embrace digital healthcare services. And I'm sure that the discussion will speak more to this as we move forward. And then, of course, providing easier access to telemedicine services, involving CSOs in strengthening telemedicine services and building their capacity to that effect. And very importantly, community engagement involving people living with NCDs and the ones that are most affected or are more at risk as important stakeholders in the effective healthcare response. Next, please. So just exactly a month back, we had the first virtual meeting of this multi-stakeholder working group. Next, please. And what you will see on your screen are some of the members of this working group, and many of them are here in this meeting as well. So we had representation from the government of Punjab, civil society organizations, medical professionals, people living with NCDs. Next, please. We even brought on board young people, so students and teachers, because we wanted this to be a comprehensive working group where we bring different stakeholders together to understand what their role could be in the already existing efforts of the government. And I'm very happy to say that the meeting was very, very well received by the government representatives who were present. Next, please. And based on, if you remember in my earlier slides, what actually took place in this first meeting was that we had a draft of guidelines ready for meaningful involvement of people living with NCDs and CSOs. And this is an excerpt of those guidelines. The working group went through and reviewed the guidelines and identified, gave their feedback. And then the guidelines were opened for discussion, it was a very, very interesting how the government, civil society, academia, medical professionals, CSOs provided perspectives of what can be their contribution towards NCD action in Punjab. And so this was a very, very interesting and comprehensive discussion where feedback from multiple levels of stakeholder were included in the guidelines. And so now at this stage, the guidelines are near final. And once these are final, next slide, please. We will be now submitting these officially to the government of Punjab and try and look at how the focus of this multi-stakeholder working group can be integrated with the existing work that is taking place in Punjab. One of the things in this meeting which was highlighted by the government representative who participated was that he appreciated that we were not trying to create another vertical silo or another working group which would act in isolation, but throughout the discussion, the focus was on that this is a convening which is looking at strengthening or contributing effectively to the existing mechanisms of partnership, of collaborative action which exist in Punjab. We are slated to hold the HIN state level civil society consultation for NCDs and universal health coverage in Punjab towards the end of this year, so hopefully sometime in November. And we're happy to say that given that we are now in a better position with respect to the pandemic, this will be an in-person meeting, the organization of which would be led by Cypher. So we look forward to welcoming all of you to that meeting as well later in the year. That's it for now. These are some of our social media pages and website, which you can access if you need more information. So I'll stop here. Thank you so much.
Thank you, ma'am. Now, can we move to the next slide, please? Thank you. Now, I'd like to welcome Dr. Sonu Goel. Professor Sonu Goel is from Department of Community Medicine and School of Public Health, PGI Chandigarh. Dr. Goel has 18 years of experience in the field of public health. He's the Vice Chair for Tobacco Control Section and leading Empower Research Group of the Union. So we'll be speaking about today's objectives of this dissemination workshop. Thank you, sir. Please.
Thank you, Dr. Barsha. At the outset, want to congratulate Cypher and Healthy India Alliance for sustaining such type of activities. I have been a part of these activities since I think February when this project was started, and I'm really happy to see the growth of these activities over a period of time. So congratulations to both the organization and all the stakeholders who are actually part of this initiative. Just want to highlight quickly why integrated management is really important. I think for the audience, everybody know, most of you know that it is the #1 cause. Cardiovascular diseases are the #1 cause of deaths and disabilities. If you see the global burden of disease report, 62% of the global diseases are cardiovascular diseases or non-communicable diseases, and primarily non-communicable diseases, 50% are cardiovascular diseases. And 73% of all deaths, again, due to cardiovascular diseases, and 80% of all dailies, which are caused, or ear loss due to disability, and again caused by non-communicable diseases. So I think everybody knows that this is a problem. Every day there is a heart attack, every day there is a stroke. So this is a problem. Now, there are multiple diseases into it. Why we should focus on integrated management? So integrated management is required because all the diseases, for 3 reasons. #1, all the diseases have common risk factors. If you see tobacco, alcohol, lack of physical activity, so all these risk factors hold true for all these non-communicable diseases. So whatever we do, we can do in a common thing. So this is #1. Second, again, these diseases have a co-occurrence. Means if somebody is having diabetes, so that person is more prone to suffer from hypertension and other cardiovascular diseases. So this means that we are having a group of diseases which we need to tackle. So for if a person is suffering from both diseases, we don't have to apply both the things. For hypertension, we are doing separate. For diabetes, we are doing separate. So there is a co-occurrence of diseases. That's why integrated management is required. And third thing, if we talk about the health system issues, we have a limited resources, whether it is human resource, whether it is supplies and all those things, and we are ill-equipped to tackle diseases individually. So to strengthen the health system, we need to tackle them together. So these are the reasons why we should do this. And for this, I think there are various strategies have been done. WHO PEN package is there. There is a national multi-sectoral plan is there. And I think today's initiative, which is really good, I must congratulate Director Health Services, Himachal Pradesh, and the speaker for today, Dr. Gopal Chauhan, as well, for I think having this integrated approach under the Mukhyamantri Nirog Yojna. This is really important, and this is one of the good practice I have seen. I have gone through the paper which was recently published by Dr. Gopal, and it was really good and worth replicating in other states as well. We had done hypertension control project in the state of Punjab. I think Cypher was the partner to it. And again, we found that there are a lot of gaps in those areas. Like, for example, the drugs are not being dispensed on the regular basis. If the drugs are done for 15 days or 21 days, and then there is a lapse for 10 days or 20 days, and then again the patient gets the drug. So there is a lot of things which we have suggested to them as well. And again, we prefer the integrated approach through involving multiple stakeholders. And media is also one of the stakeholders which need to be taken care of, through which we can disseminate such sort of information. And I think we are working on tobacco control. So we are happy to work with I think Healthy India Alliance for some sort of research activities or implementation activities also, for I think the betterment of health of the country. So I again congratulate both of the organization and also the speaker for today, and looking forward to listening to Dr. Gopal Chauhan for this very good initiatives which he has taken in the state of Himachal Pradesh. Thank you very much.
Thank you, Dr. Goel. Thank you for taking us to the current burden of NCDs as well as the risk factors and highlighting the need of integrated management. Like these gaps and challenges you mentioned actually give us all a food for thought to steer up actions to address them. Thank you so much, sir. Now I'd like to invite Dr. Rana Jai Singh. Dr. Rana Jai Singh is Deputy Regional Director, Tobacco and NCD Control, the Union Southeast Asia Office. He has conducted extensive research on the efficacy of integrated session support with patients' TB treatment regimens and has been heading the introduction of such programs in 6 states in early 2016. Dr. Singh and his team have worked with WHO under the leadership of Ministry of Health to create training material for the above mentioned launch. Dr. Singh will be giving us an overview on the current NCD scenario in India and also will be sharing his insights. Please, sir.
Thank you, Dr. Barsa. Thank you, Dr. Rakesh Gupta, President Cypher and Healthy India Alliance for organizing this program on use of digital approaches in prevention and control of NCDs with the focus on state of Himachal Pradesh. So today's discussion, so we will learn a lot many things. So great to know that health leadership in Himachal Pradesh is here, and we have a lot many things to learn from them. You see, in last few years, especially in last 1 decade, there have been many advances in the area of data management, artificial intelligence, which has opened new opportunities for monitoring health and preventing and controlling of non-communicable diseases. So very recently, Union Minister of Health and Family Welfare, Dr. Mansukh Mandia, while addressing sessions on World Economic Forum, he briefed about unlocking the power of digital health, which is a great equalizer, you can say an enabler to support universal health coverage and sustainable development goals. Currently, in this scenario, we can't imagine achievements of our sustainable development goals, not only in health, but in any other area, without use of digital approaches. So I think this is very important for all of us to understand. And nowadays, use of digital approaches is like, we feel it is like empowering the people who are responsible for health management. And at the same time, to ensure safety, accuracy, and efficacy of digital health solutions. So this is something which is really very crucial. Now, as far as non-communicable disease is concerned, when we look at within our own country and globally, we find that many such initiatives are there. And what are those initiatives? And they address almost every aspect of non-communicable diseases. And what is the first aspect? That is prevention. So what are the various digital approaches being used for prevention of NCD? For example, in European countries, now they are testing meal delivery apps, food delivery apps, which are online app tools that allow customers to order food or drinks. We can develop a data platform that will allow health authorities to assess the type of food which is offered by these food delivery apps, as what is their nutritional quality, what is the level of salt or maybe trans fats. So all those things can be done and can be monitored. Similarly, other risk factor, that is physical inactivity. For that, again, there are many such digital solutions. Use of accelerometer, which is an objective method of measuring time spent in moderate or physical activity. Total physical activity, how much total activity has been done. So what is sedentary behavior and sleep? So all those things can be monitored. Many countries now, they are pilot testing a methodology for measuring physical activity in children aged under 5 as part of, there is a project in Europe, Sunrise study in Europe. So I think all those things we should look at. Similarly, Other risk factor, that is alcohol. So we have now alcohol, animated alcohol assessment tools, and the amount and frequency and intensity of alcohol drinking, quantify individual risk, and offer what we call as tailored feedback to the users. Other risk factor, that is tobacco use. So I think this is another important area, how we can digitally address this. And very recently, you remember last year, World No Tobacco Day theme was on suggestion, where WHO launched its Florence, which is a digital health worker, which dispels the myths about COVID-19 and tobacco. It helps people to develop a personalized plan to quit tobacco and recommends WHO approaches for suggestion. So I think there are apps, there are digital solutions, first of all, to monitor risk factors, as well as to provide solutions. Then other important area, which now come to state of Himachal Pradesh, that is surveillance. So I think digital technology has really played a very important role. We have various ways of doing that. Dr. Gopal has used one way of using Android operating system. So as an electronic data collection tool, which provides information, lot of information about prevalence of various NCDs through this screening tool. So Himachal Pradesh is really a big example of screening of non-communicable diseases. All its population, I think, above 18 years of age, which has not happened before. Perhaps digital technology has really played an important role in that. Had that not been there, I am not aware whether we will have been able to monitor and have surveillance of. So really, it's a seminal, or you can say landmark work in state of Himachal Pradesh. So there are many benefits of doing this kind of data collection, as you all are aware. Immediate error checking during data collection, tracking field work in, you can say, in real time, sending data to centralized server immediately as it is collected, and it also reduces the material to be carried by data collectors. So really it's important. So this is a second use which can be done in for as digital approaches to non-communicable diseases. Then all other things, all of us are aware, use of digital technology for capacity building. So many online trainings, platforms for NCDs are there, can also be launched in future depending on our needs. Then diagnosis, treatment and management of non-communicable diseases, again, use of NCDs. Then monitoring of policies and programs related to NCDs, so which is an important component. So everything related to NCD, from prevention to monitoring and research. So all at different levels, we can use digital approaches in NCDs. So let's hear from Dr. Gopal Chauhan, which what kind of work he has done. So in the end, I would just like to recommend that although many things are happening here and there, it's now time for mapping of all those digital interventions in India, what is happening around, some good experiences, and globally also, especially in low and middle income countries. You see, there are perhaps European countries, developed countries, they were a little bit way ahead of us as far as use of digital technology for health is concerned. So let's see what are replicable experiences from low and middle income countries, even our neighboring countries of Bangladesh, Pakistan, or maybe other Nepal, Myanmar, and to collect and collate examples of digital health approaches being used there. Let's study them, modify them to our Indian context, and develop new ones whenever it is required to cater all demographic locations in the country. So we need to see currently what is happening. Most of the programs right now, perhaps the focus right now, they have not been able to reach benefits of the programs, have not reached the ultimate person in the remotest location of our country, in a village. So all those solutions, please keep in mind while we are doing that, that they reach ultimate person in our country. Once again, thank you. Union always very eager to work with all of you, and whatever responsibilities you assign. So I will be there to contribute. So this is all, and best wishes. Over to Dr. Barsa. Thank you very much.
Thank you, Dr. Singh. Thank you for highlighting the importance of digital interventions as a key step to achieve the SDGs. The examples you mentioned from the other countries can be taken up by India to amplify the ongoing efforts to scale up the digital intervention in our country. Thank you so much, sir. Now, I would like to welcome Dr. Gopal Chauhan. Dr. Gopal Chauhan is SPO NPCDCS and Palliative Care, Himachal Pradesh. He is implementing the integrated digital approach for the NCDs prevention and control in Himachal Pradesh. Dr. Chauhan is the technical resource person for NCDs, tobacco control, and SDGs with many state governments and NGOs at international and national level, including Johns Hopkins University, USA. So we'll be giving the keynote address today for this session, and we'll be sharing the experiences and learnings from the integrated digital approach for prevention and control of NCDs in Himachal Pradesh. Over to you, sir.
Thank you, Varsha. Am I audible?
Yes, sir. Yes.
Okay. Thank you very much. First of all, respected senior colleagues, my dear friends from outside state and from the state of Himachal Pradesh, and our entire NCD team from the state of Himachal Pradesh, ranging from Mission Director, National Health Mission, Director Health Services, up to the ASHA level. Thank you, Cypher, for and ERCT PGMR Chandigarh, this Healthy India Alliance for giving me the opportunity to present that what we are doing. Actually, this is what you have told us to do. All my senior colleagues like Professor J.S. Thakur from PGI Chandigarh, who has been a mentor since starting of this initiative in the state, Dr. Anajay Singh, Dr. Monica, Dr. Radhika, Dr. Sonu Goel, Dr. Rakesh Gupta. I think what we are doing, we are learning from you people, the senior colleagues, and from across the states. Then we are trying to implement those strategies that whether they can be something better can be done. And this is something what we have done in last 2 or 3 years. And now this is the time that you have to evaluate this on scientific basis. Whether this is what we are doing is better for replication or not. And what I will be trying to do, I will be presenting that what we have done, what we are trying to do, what kind of gaps we are we have seen, and what are our strategies to mitigate those things. And finally, we will welcome the suggestions and guidance from all of you. The outline of my presentation will be why NCD prevention and control, as my previous speakers has highlighted on this issue, burden of NCDs nationally, globally, and in the state of Himachal Pradesh, because I will be talking more about the state of Himachal Pradesh. Then what are the best strategies globally, nationally, and sub-national level, and then what Government of India is trying to do to combat NCDs. Himachal model, though this is not yet, I will not say that this is a model, but we are moving forward, that what we are trying to achieve and how we are trying to achieve. This is what I wanted to tell. Then what are the key achievements, challenges, opportunities, and the way forward. Next, please. This is for those who are very new in NCDs. We have been taught like this, that we are facing a transition in the society. And the most important is the epidemiological transition. We are moving from communicable to non-communicable diseases, as rightly said by Professor Sonu Goel, that as of now, the premature mortality due to NCDs is more than 80% in a country like India. Next, please. Yes, why NCD prevention and control is very important. Remember this slide. This is to show that there will be a huge economic burden on all of us at national, sub-national, at international level to address NCDs if we don't take the preventive and health promoting measures, because the patient with diabetes, hypertension, cardiovascular disease, cancers, mental illness is likely to live long. There will be a huge economic burden. The burden will be on the family, on the system, maybe the health system, maybe the GDP overall. Then we have to think that how we can reduce this burden. This is one aspect. Second aspect is the productivity loss. Because if we talk about the productive age group below 70 years of age, then we don't think that there should be diabetic, hypertensive, and the person, those who are suffering with stroke and some other NCDs, because there will be loss of dailies and qualities, and which will reflect in greater economic losses. Next, please. Now, coming to the NCD burden in India, you can see that around about 80% of the total burden of the premature mortality is due to NCDs. It includes very important aspect of 12%, which is due to injuries. Though in India, we are not much talking about injuries, but in the next few years, this is going to be a big, big issue if we don't address this issue, because most of the NCDs, as Dr. Sonugul has said, that they share common risk factors, they have a similar course of action, and the preventive strategy and promotive strategy is almost similar. Then we have to adopt an integrated approach for NCD prevention and control. Next, please. Now, coming to the state of Himachal Pradesh. I belong to this state in North India with a population of around about 7 million. Before 2015, wherever we used to talk, everyone used to say that Himachali are healthy. We walk up in the hills, and there is a lot of good environment, and everybody is working. But after this report in 2015, which was the ICMR and this Government of India report, Health of the Nation State, we came to know that the NCD burden in the state of Himachal Pradesh is higher than the country average. It means that there are some factors we are not able to understand. There were few studies from Medical College Shimla, from Tanda Medical College, and from Himachal Pradesh University. They were also highlighting the issues, but nobody was ready to hear them. But everybody was saying that we are healthy, everybody looks fit. But after this report, we were able to think that we need to do something in the state of Himachal Pradesh. You see that the major risk factors are malnutrition, hypertension, dietary risk, tobacco use, alcohol, drug, and high BMI. Can you think that in a state of Himachal Pradesh, where the per capita income is more than 2 lakh, in the state per individual per year, then we are talking of malnutrition. As per the NFHS data, there is a lot of stunting. It means that there are certain issues which we are not able to address. Then you talk about high BMI. I would like to say that in last 5 or 7 years, there is a 200% rise in obesity among female in Himachal Pradesh, and 120% rise in obesity in male. It was a time when we used to say that the plain area, the people living in some sort of sedentary lifestyle, that the issue might be there. But in Himachal Pradesh, we are able to understand now it very clearly that this is a big, big problem in the state of Himachal Pradesh. Next, please. Yes, globally, I will be summarizing it in a slide, that these are the few steps. If you want to work in NCD prevention and control, you have to do these things. For example, if we are doing tobacco control, we have to implement the empower strategies. These are the global strategies. First, we should have a data, we should have survey or surveillance, so that we can find that what is the quantum of problem, how many NCDs are there, and what are the risk factors, where are the risk factors. Second, there should be risk reduction strategy. We are doing something for tobacco, alcohol, and healthy diet, but they may not educate, and unless you address the risk factors, you cannot talk much about the prevention and control of NCDs. Third one is the screening and early diagnosis. Government of India is scaling up screening in the country, but it is very, very important. Early screening and early diagnosis can even treat the cancer patients if they are diagnosed well in time. Then another part is health promotion. These all 4 things are inadequate unless we develop a comprehensive health promotion plan in the national or subnational level. Then, of course, if somebody is suffering with NCDs, we have to manage those NCDs. It may be cancer, diabetes, hypertension. We cannot ignore those patients, and it is said that the screening without adequate treatment facilities is unethical. Then we have to have backup of drugs and diagnostics, and then follow-up and rehabilitation is very, very important, because there are cases of lapses, and if you lose the follow-up, because the control rate of the NCDs is quite less, and then there is a lot of chance that patients are going to relapse. NCD prevention and control in Himachal Pradesh. This is a Government of India program in which we have done some innovation while doing some integration. It was started in the 3 hard districts in 2009-10. It was launched in India in 100 districts, which were very hard districts. And then the common, what was written in the book and guidelines, risk reduction, NCD screening, early diagnosis of plus 30 population. Then 2016 onward, they said that the opportunistic screening has to be shifted to the population-based screening. What is the difference in opportunistic screening? Before 2016, the guideline used to say that those who are coming to the institution, maybe sub-center, maybe PSC, they have to be screened for diabetes and hypertension if the age is above 30. But after 2016, they are saying that the ASHA worker will be going through a checklist. We call that CBAC to the houses. Then it is known as the population-based screening. Then the entire population has to be screened. Now, coming to the health and wellness center part, now we are, the health wellness centers are coming up. Additional CHO or mid-level service provider has been placed in sub-centers. They take care of NCDs. This is their domain area. Now the screening, NCD screening has to be focused more on the health and wellness centers. Next. These are the conditionalities of Government of India, which are the yearly targets. And I am happy that we are achieving all those targets on annual basis, and we have been, incentivized for achieving all those targets. These are the numbers, that this much of minimum hypertension screening has to happen. This much of screening for diabetes has to happen. I think the states like Kerala, Tamil Nadu, northeastern states, they also been good in this part. Next, please. Yes. What are the issues in NPCDCS program? This is very important to understand that, we are implementing a program which is given by Government of India. What are the issues? The issues are, number one is a poor surveillance. We are trying the digital application of Government of India, Himachal Pradesh government, Tamil Nadu has own application, Kerala is having own application, many more states are having own NCD-related application. There are some, ICMR projects going on, ISCI program is going on. But, we don't have a good, a system of, surveillance, maybe some, data collection that which is definitely giving you good results and which is being implemented effectively up to the ASHA worker, because down the lane, the work is being done by ASHA worker and health workers. We need to understand that what their capacity is. Maybe very good in developing software, but until unless they are not able to use those software, then it is of no use. Then lack of continuum of care. Government of India is trying to push the screening plus 30 in the plus 30 population. And the major risk factors of NCD comes into play in the age group of 18 to 30 years. Maybe alcohol, unhealthy diet, tobacco use, or physical activity and stress. Until unless we address this group, then they are going to land in NCDs, then we will try to, treat them. Then Government of India strategies, they are trying to digitize the things, but still there are 3 reporting systems, which is very, very painful for all of us, to those who are working at state level and district level and sub-district level. We have to fill up 3 forms. One is the manual form 6 for NCDs for the same patients. Then another is the health and wellness center portal. Third one is the Government of India NCD application. Though we are having our own NCD application, we are pushing the data to Government of India application through API. But for a health worker, for a CHO, for a MO, it's very, very painful that he has to fill up the same data. Government of India is telling that they are trying to integrate all this software so that there will be a single portal of entry. But as of now, there are, I think, more than 48 portals. It's very difficult to remember all those passwords and the login IDs. Then there is a clear-cut lack of health promotion strategy and a risk reduction strategy. We are doing partially for tobacco control, but I don't think anything is being done at nationally for alcohol, physical activity, and something like that. Next, please. Then what we did to bridge those gaps in the state of Himachal Pradesh with multi-stakeholder consultation involving PGI Chandigarh, Union, Hirde, WHO headquarter, and all other professors, senior faculties from Medical College Shimla, and all experts from ICMR Chennai. Then we were able to develop a scheme known as Mukhyamantri Nirog Yojna,
Dr. Gopal.
I think we lost connection with Dr. Gopal.
Yes, Dr. Chauhan, we can't hear you.
Okay.
But Varsa, I think he's in the waiting room.
He just joined. I'll just check. Dr. Chauhan, am I audible now? I'm so sorry, sir. We can't hear you.
Am I audible, Varsha?
Yes, sir. Yes, sir.
Okay, then these are the challenges we face in digital system. But yeah, am I clearly audible?
Yes, sir.
Okay, next please. Okay. What are the key strategies for NCD prevention and control in the state of Himachal Pradesh? We are doing the risk assessment of plus 18 population. We are adopting integrated approach because previously we used to have different checklists, one for mental health, another for blindness, another for deafness control, another for this diabetes, hypertension. There was another checklist for cancer screening. We integrated all those checklists and developed a common CBAC. We call that integrated approach. Then everything was digitized through our digital platform known as e-health card. We are focusing as per the Government of India program on the screening and early diagnosis, management of NCD. We know that after active screening, there will be a lot of load on the health institutions. Then we are trying to develop the Nirog clinics in high load facilities. What we do in those clinics, 2 MBBS doctors are trained for NCD prevention and control, maybe cardiac illnesses, maybe cancer care, maybe stroke, dialysis. And they used to refer the patient, those who need specialized consultation, and otherwise they send the patient to the CHO and medical officers at field level. Then it is being backed up through the pre-drugs and diagnostics. Then we have rehabilitation services. Then for risk reduction, we have developed a state policy. It is yet to be notified. And because we were thinking that something comprehensive has to be done for health promotion in the state of Himachal Pradesh. Next, please. This is the CBAC, we call it. This is a checklist by which the data collection is being done by the ASHA workers from door to door. We are adopting this for all 10 NCDs, maybe this diabetes, hypertension, cancer, mental illnesses, blindnesses, deafness. And we are, what we are doing, this is for plus 18 population in the state of Himachal Pradesh. Next, please. This is some sort of IEC material. When the ASHA worker is going to the houses, then she used to discuss this kind of pamphlet with each individual that what need to do for prevention and control of NCDs and for healthy life. Next, please. This is the digital application of Himachal Pradesh. We call it e-health card. This can be downloaded from the Play Store. The login IDs and passwords are available with each and every health worker and CHOs. The ASHA worker is collecting the manual information on the manual CBAC, but we are going to digitize it very soon. That after giving mobile phones to the ASHA workers which are there in Himachal Pradesh, this will be 100% digitization of the manual work, which was as Dr. Rana pointed out that lot of forms has to be collected at state level. But now this is all digitization. Next, please. Now you see the progress of the Mukhyamantri Nirog Yojna in the last 3 years. It is a cohort. For example, a person who has been screened in 2018, he has to be screened in 2019, 2020 also. Till date, we have been able to digitize 27 lakh people, 2.6 or 2.7 million people, which is 60% of the entire plus 18 population in the state of Himachal Pradesh. It means we have digitized the risk profile of around about 2.7 million people out of the target population of 4.4 million, out of which 1.8 million are having some sort of risk. Maybe they are having some, somebody is a smoker in their family. They are, ex-smokers, and they might be having some, family history of diabetes, hypertension. Then out of those 18 lakh people, 11 lakh has reported for screening to the health workers and CHOs. Screening means when there is a checkup of diabetes, hypertension, waist circumference, oral examination, and breast examination. Then out of 11 lakhs, 2 lakh people has been found with having high BP, high blood sugar, high waist circumference. But more than double reported to the doctors, because few went to the doctor directly without wasting time. For example, there is a breast lump which is clear cut and which has been seen by the health worker. There is some gross abnormality. They don't send it to the nearest PSC, they send to the specialist directly. Round about 4 lakh people has reported to the doctors, and as of now, around about 70,000 people or patients, we can say that they are under under treatment and they are under follow-up. Next, please. These are the graphs and tables which are available at state, district, sub-district level, block level, and even sub-center level. What is the use of this data? For example, we can say that in my state, 35% people are taking unhealthy diet, and tobacco users are 12%. This is a surveillance. This is an ongoing system. Now, what are my focus area? For example, in a district like Una, we see that there is a, the obesity is one of the reasons. And in disease, we see that there are a lot of diabetic patients are there. It means our IEC, our resource allocation, our focus has to be on the risk factors which are prevalent in that area. The situation is different in different districts. It is not uniform. This is the reason that this kind of surveillance is giving us the insight for intervention. Next, please. Now you see the prevalence of high blood pressure, blood sugar, waist circumference, loss to follow-up. This is also varying from district to district and from blocks to block. The BMO can visualize that what is my problem, where is the problem, and the data is individual wise. This is a OTP protected data. Nobody can access it, outside the health system, and the individual can access the data. The use to the individual is the alarms are coming on their mobile phones, and there is an alert also. If the alert is red, it means there is a disease. If the alert is yellow, it means that they are on risk. If the alert is green, there is a color coding, then it means that there is no problem. Next, please. Yes, this is the proportion of diseases. We talk of lung cancer, breast cancer, cervical cancer, mental illness, stroke, oral cancer, epilepsy, other CBDs, and other cancers, deafness, COPD, asthma, blindness, and hypertension and diabetes. These are the graphs, and this is patient wise. We have the data of these patients that they are having some problem, and what is the problem? Now the issue is how many are on follow-up. I will tell you the follow-up is being ensured because the ASHA are incentivized for follow-up, and we are thinking that there is a at par surveillance, at par follow-up with the of all the patients, those who are put on NCD treatment. Next, please. Yes, these kind of data is available for plus 18 population, 18 to 30 plus population, 30 plus population. We have the different cohorts. You can see that in 18 to 30 year population, we were surprised that there is a lot of, this group is having a lot of diabetic and hypertensive patients. This is the things that they are on risk. And if they are on risk, if they are not treated well in time, if they are not screened adequately, they will land into some diseases in later stages of their life. Next, please. Yes, the data of Himachal Pradesh is being fetched to the Government of India NCD portal, and you can clearly visualize that with other states, our data is in the Government of India application, which is appearing there because we are not adopting or using the Government of India NCD application. We are migrating the data from the state because they are having some less fields and we are having broader fields. Next, please. Now coming to the risk reduction. Yes, in tobacco control, we are on the right track as per the GATS and GYTS. But for alcohol, certainly it is a worrisome issue that there is a rise in alcohol use. Unhealthy diet, we have a right campaign. For physical activity, for stress, we are promoting yoga at Health Wellness Center. For obesity, but there was not a concrete plan to reduce all those things. This is the reason that with the multiple stakeholder engagement, we developed a state-specific health promoting policy, and we are in a process to notify the policy so that it can be implemented. It will cover the entire health promotion, the area, and we will, in the meantime, we will evaluate that, how it is moving forward. Next, please. Yes, another core area of health promotion in the state of Himachal Pradesh, we are having a health promoting education institution protocol. It is a WHO protocol which we are following. We have customized it, and now the certification of the schools has already been started in the state of Himachal Pradesh. There was a bit downfall during COVID, but it has been geared up now. Then coming to the tobacco-free education institution guidelines, we are implementing those guidelines. Then we have another tobacco-free panchayat scheme. We used to reward a panchayat if they achieve the tobacco-free status with a cash prize of 5 lakh rupees. Then the health promotion policy which I have talked. Next, please. Yes, this is the certification of the health promoting education institution. Then the health promoting policy, the tobacco-free panchayat guidelines, then the tobacco-free education institution guidelines. Next, please. Yes. Now coming to the management of NCDs. You know that if we don't manage NCDs, then we will end up in a situation that we are screening people, we don't have something to manage. This is the reason that we are focusing more on creation of the integrated neuro clinics. The neuro clinics will be in the high load facilities and they will take care of all the NCDs. Then CBDs, we are having cardiac care unit in all district hospitals. Now the STEMI care project which was running in district Shimla, it has to be replicated, and today in the afternoon there is a training session for the medical officers that how it can be scaled up. To address the CKDs, we have 20 dialysis units which are functioning in the state. We have decentralized 7 chemotherapy units. We are giving chemotherapy at district and sub-district level through MBBS doctors through the guidance of the specialists. Then we have the palliative care units at 11 locations. We have the stroke care units in 19 locations. Then we have mental health unit at 10 locations. And now we are going for the tele-mental health program from 10th of October. For NFLD, we have a protocol that who has to be screened, how is that to be screened, and we have fibroscan facilities at 2 places. The protocol is very simple. The person who is having obesity with diabetes and hypertension, then they have to be, without doing ultrasound, the fibroscan has to be done. The annual reports of each and every program, they are uploaded in the National Health Mission website. If somebody want to see, they can see. Then what happened during COVID? The line listing and this kind of treatment facility, they were very helpful in addressing the NCDs during the COVID time. This is the reason that if you see the death rate among NCD patients in the state of Himachal Pradesh was quite less in comparison to even the better states in India. This happened that we were having mapping of the patients, we were having the line listing of the patient, and we could allocate the resources, and we could do the digitization, decentralized approach in the form of digitization apart from tele and e-Sanjeevani. Direct consultation from the specialist was being given to the doctors and the staff at field level. Next, please.
Dr. Chauhan, sorry to interrupt, sir. A humble request from our side. Actually, Professor Monica Arora, our guest of honor for today, is having a prior commitment. Can we please take her slides first and then we can continue with your slides? Is it okay with you, sir?
Yes, I'm very much comfortable because I have only
so
2-3 slides. Okay, thank you.
Okay, thank you so much, sir. Sir, can we move to Dr. Arora's slide? Yeah, thank you. Now I'd like to welcome and introduce our guest of honor. Welcome, Professor Monica Arora, and thank you for joining us today. Dr. Arora is a public health scientist working in the area of preventing and managing NCDs through health promotion and health advocacy. She is the Vice President, Research and Health Promotion at the Public Health Foundation of India. She is Executive Director of FRIDE, President-elect of NCD Alliance, and Chairperson of Southeast Asia NCD Alliance. I request Dr. Arora to please address the session. Thank you, ma'am.
Thank you so much, Barsa, and apologies, Dr. Chauhan. We had to, in between, start this presentation. I won't take a lot of time because I'll have to leave in 5 to 7 minutes. But I think we have said all that I wanted to say. So very important points that have been brought out since morning. I would only like to supplement the information that has been shared in the morning to say that even though we did hear there are 62% of all deaths in India are NCD related, but one issue we need to see here is that these NCDs drive millions of people into poverty. So it's not just a health issue, it is a multi-sectoral issue. And when nation or states are handling the issue of NCDs, it need not be only looked at from the health lens. We need to start looking at it from a development perspective and start talking about how other sectors can contribute to NCD prevention and control. Second issue that I wanted to highlight is community engagement. So what we have done in community engagement is in Healthy India Alliance, we have already conducted community conversations in India. So 4 community conversations in 3 regions engaged 49 people living with NCDs. And why there is need to engage people living with NCDs is if we talk about health promotion policy, as excellently Himachal has put in place, that is the need of the hour. And we will not be able to get success in NCD prevention and control till the patients take ownership of this condition. If a patient with diabetes say, I take a white tablet in the morning without knowing what is the role of that tablet or what is the function of that particular intervention, so we will never be able to overcome the problem of NCD prevention and control. So we as healthcare providers have failed in our duty if we don't empower patients living with NCDs and we don't engage them, because it is their right to know what are the treatment pathways. They should contribute to their decision-making on what is the right course of action. So moving forward, can I get the next slide, please? So after we did the community conversations in India, we did have regional consultations so as to expand this network, bringing communities into NCD prevention and control, they becoming future leaders for getting more people living with NCDs involved in such campaigns so that we can understand what their perceptions, roadblocks, issues are, so that health system can be responsive to their needs. Next slide, please. So the whole process starts with having country level trainers who are trained by the Global NCD Alliance, and then we adapt that training to the country context. So there were 3 in-country team leaders who were trained by NCD Alliance, and then they conducted country-level trainings for 40 people living with NCDs. Now we have a very strong network of people living with NCDs who contribute to many campaigns and provide very important insights to us. Next slide, please. Recently, we conducted another training, which is promoting meaningful engagement of people living with NCDs, which is to say that people who are NCD experienced, how they can be meaningfully engaged, not only in awareness, but also on national multi-sectoral action plans. State level action plans can be developed. We have a NPCDCS, which is a national program, but at the state level, we can have activities and groups where patients become important stakeholders. So my request to all the states who are here today is, when you create state level multi-sectoral action plans or working group, please ensure we have patient voices heard. Next slide, please. This is the India advocacy agenda, which came out of the community conversations. It's based on 4 key pillars: human rights and social justice, prevention, treatment, care and support, and meaningful involvement. The patients need not be involved tokenistically, but it is very important that we have meaningful engagement of them and their voices are heard, both on prevention, treatment, care, and support. They would be an excellent resource which can be integrated into the health system. They become very equivalent to ASHAs or ANMs if they are properly trained, and they can do hand-holding for new patients who come into the system, and that will also reduce the burden on the health system. Next slide, please. These are several situational analysis reports which have been undertaken by the Healthy India Alliance with partners in different states as well as at the national level. And these have brought out issues like accessibility of health system, affordability, and how those issues can be addressed at all levels. So state governments will surely need to invest more in NCD prevention and control if we have to see the benefits of the program being implemented. And when we say increased investment, that can come about with integration, as what Dr. Sonu Goyal had mentioned. Integration will help us bring our resources into a common pool, and then we will be able to provide better services for people living with these conditions. Next slide. So on the integration part, we recently had a roundtable meeting with various groups who are working not only on NCD, but TB and HIV to cross-learn from each other as to how effectively to engage people with lived experience, and also what integration works and what does not work. Next slide. So many of our recommendations have been time and again published in various op-eds so that we can get our voices heard amongst the policymakers, decision makers, and also widen the whole campaign of NCD prevention and control. Next slide. Our efforts have also informed the global charter on meaningful involvement of people living with NCDs. And it is based on the principle that people with lived experience should be involved in decision-making, and many countries, organizations, and groups are endorsing this charter. So endorsing the charter means they respect these values, and there are multiple set of principles which are provided on how to engage people meaningfully. Next slide. I think Dr. Gopal Chauhan will talk in depth about this program, and I need not. We have been hearing about it. The only point I would like to make here is that COVID-19 pandemic has shown us that siloed programs do not work. They are unfit for the purpose and need to be integrated with the primary health care. Also, the growing burden of multimorbidity and the bidirectional relationships between communicable diseases and non-communicable diseases, they underscore the need to dismantle disease-specific silos, emphasizing reforms and investments that involve a wide range of health outcomes. Let's start thinking and planning on those lines. And pandemic preparedness and the health security cannot be separated from the effort to prevent NCDs and strengthen basic services for chronic care and acute complications. So I would like to end my presentation just with 3 very important key takeaways, which I would request if the states can implement: state level, multi-sectoral and multi-stakeholder working groups to be established for integrated approach, greater engagement of people living with NCDs in these plannings, and integration across the programs. Digitization and e-health cards are very, very welcome step in this fight against NCD prevention and control. So we have a lot to learn from Himachal and keep building on what is available in the country on health technology. There is AI interventions in NCD prevention and control that help the healthcare providers use algorithms, make diagnoses, and be faster in their reach to the patients. So let's start taking all the technology which is available to strengthen our resolve and our performance in NCD prevention and control. Thank you so much.
Thank you so much, Dr. Arora. Now, please, ma'am, I request you to stay back for a minute, and I request everyone to please switch on their cameras. We will have a group photograph right now, please. And I request Cypher team to please stop sharing the screen for the moment. Thank you. I'll be taking the picture. Done. Thank you so much, sir. Thank you, ma'am. Thank you, everyone.
Thank you so much. Bye-bye.
Now I request to please start with Dr. Chauhan's slides. Can we go back to the same, please?
I think it's almost end from my side. I think only 2 slides are left. I think Dr. Monica will be staying back. She's also one of the mentors for all of us since beginning. Yeah, these are few of the important notifications. Thank you, Dr. Monica, for highlighting the key issues, and definitely it is always very nice to hear you. The state, whatever we are doing, there is some administrative and political commitment. What we do, we gather some information, then we discuss it with the key stakeholders, with experts. Then we go, because in a Sarkari system, these orders, notifications are very, very important, because we cannot push the system, in a very simplistic kind of manner. Next, please. These are all notifications, maybe the cancer care, maybe the hypertension care, what are the protocols, who has to be contacted, how the patient has to be, roped in, what is the mechanism of follow-up. For example, there is a patient who is under treatment from PGI Chandigarh, but he belongs to Himachal Pradesh. He has to come back to his village. The ASHA will keep a track. She is being paid under NCD program for the follow-up. Then she used to report to the health. This is the mechanism that we are trying to develop. Until, in future, we are planning something bigger, so that we need not help of, ASHA workers and CHOs for data entry. Individual can upload their data, but we should have some system to verify the data, whether the data is correct or incorrect. We need some evidence so that if some scoring can be done. Next, please. Yes, these are all part of the notification. Next, please. Yes, I have already shared the outcomes of the GATS and GYTS in the state of Himachal Pradesh. What the window of opportunities? We have the lowest prevalence of tobacco use in the 13 to 15-year age group. This is the, I think, if we can sustain that, we can end up our broader goal of achieving tobacco end game of less than 5% 2030. Next, please. Next, please. Yes. There are few rewards and recognition. We have been recognized at national level and international level. We have been awarded for digitization at global level also. But at Government of India level also. But there are certain issues. There are certain challenges. There are certain gaps. Next, please. One of the biggest challenges, NCD prevention and control is still a low priority. I am saying, due to, as of now, you will see that there is a lot of, noise about TB control. It was COVID, before that. NCDs are always there. Some issues coming up and NCDs are on hidden side. And the patient does not die at once. So it is on back foot. We need to prioritize that. Dr. Monica said that there are other economic losses also. And there is aggressive promotion of the NCD risk factor. You see all celebrities are promoting health, unhealthy diet, tobacco, alcohol, maybe surrogate, indirect advertisement. Then the problem is the vertical approaches. We have another approach for, cancer treatment, hypertension control, mental health care, blindness, deafness. These are, these are utilizing a lot of resources in terms of HR and other economic resources. We need to integrate all those things. Then the solutions are, integration and digitization and, health promotion. These are 2 points. And I am lucky that I could copy paste Dr. Monica's advice about integration, digitization, and health promotion. Next, please. Yes, this is my last line. We are having annual plan, then 5-year plan, then the plan by 2030. What we plan for this year? We want to enroll, as this point of time, we have enrolled 65% of the population of the entire plus 18. We want to enroll 80% population by the end of this year, and they will be screened for common NCDs. To increase the uptake of the neuro clinics, which is very, very vital. Otherwise, there will be a lot of pressure on the specialists at district and sub-district level hospitals. To improve the hypertension control more than 50%. In Himachal Pradesh, I will say that under this Health Rise project, the hypertension control was around about 40% and the diabetes control was around about 30%, which is one of the highest in the country, but it has to be increased more than 50%. To implement the health promotion policy. Then what we are trying to do, because there are a lot of questions from inside state even, that we want to evaluate this scheme. We have written to PGI Chandigarh, written to Tanda Medical College, we have written to Medical College Shimla to do the concurrent and independent evaluation of this scheme, so that we can come to know that what are the gaps, how it is going to be beneficial to the people, and how it is to be taken forward. And then the target for 2030 is to reduce the burden of NCDs from existing 65% to below 40% as a long-term goal. Then the ultimate idea is to empower individuals so that they can do their self-risk assessment. And it was said by the Chief Secretary in a meeting that we will try to record this annual health checkup in the service book of the employees, so that they come forward for the annual health checkup. It should be recorded, and there may be some penalty to the people, those who are not coming forward. And in the end, I expect suggestions and guidance from all the experts and all of you. And special thanks to our partners. Special thanks to Mr. Vikas Rajput of eTech Services, who have developed the software for the state of Himachal Pradesh, which is easy to use. And this is the data which can be retrieved from that software, and our NGO partners in the state, and the expert group which we have constituted in the state of Himachal Pradesh. Thank you very much, Cypher, and all the organizers for giving me the opportunity. Thank you.
Thank you so much, sir. Thank you for highlighting the catastrophic expenditure of NCDs on Indian population, which is indeed a matter of concern right now. And congratulations, sir, for taking forward this great initiative of digital intervention to combat NCDs in Himachal Pradesh and creating an example for all. Thank you. When else who is not sorry for the interruption. Now I'd like to welcome our guest of honor, Dr. Anita Mahajan. Thank you, ma'am, for joining us today. Dr. Mahajan is currently working as Director Health Services in Himachal Pradesh. She is the first lady medical doctor to be appointed as Director Health Services from IGMC Shimla in Himachal Pradesh. She is working also as Project Director, State AIDS Control Society in Himachal Pradesh. I request Dr. Mahajan to please join us and please address the session. Thank you, ma'am.
We can allow participants to ask questions.
Yes, yes, sir. Yes, sir.
So I think ask question.
I can see Dr. Anupam and Dr. Rakesh Gupta have raised their hands. So please go ahead.
My question is to Dr. Gopal, actually, and I have a question about the selection of the age group. Why 18 plus when NCDs are generally seen in the population which are 30 plus and above? So that's first question. I also want to know what is the engagement for the palliative care in the state, and the workplace initiatives, which perhaps could have also been very useful.
Okay, sir. Thank you very much for asking these questions. These are very tough questions, very difficult to answer. But the idea of including plus 18 population was very simple. All the major risk factors, maybe tobacco, alcohol, unhealthy diet, physical activity, and stress, they comes into play in the 18 to 30 age group. And if we don't sensitize people at that level, if we don't screen them, screening is not just only pricking, it is a process why we are asking few questions, we are discussing, and then we are, doing the screening. This is the reason that we included. There was a long debate in Government of India that why you are including. Then, ultimately they approved that, yes, 18 to 30 age group has to be done. Now Tamil Nadu is doing it, and 2 or 3 states are doing it for 18 plus population. Second question is about palliative care. Palliative care is very important, and we have sent doctors to doctors and staff for training to Trivandrum with the Pallium India. Now we have a center in Medical College Shimla. We are taking help of the center. The take-up has increased. We have, morphine availability as 10 places. And because that is the core component, morphine is one of the major component of this palliative care. I don't think that this is up to the mark, but this is just a start. Third one is about the workplace, health promotion at workplaces. Sir, this is the core area of our health promotion policy, which we have drafted. The policy has been drafted in consultation with the experts, the implementers, and even the NGOs, even the staff, those who are working in the offices, that what kind of environment they are facing. I hope that with the due course of time, the policy will be notified, and it can give the good results. Moreover, we will evaluate that what has happened, and after that, whatever are the changes, we will try to do that. Thank you, sir.
Thank you very much. Thanks a lot.
DHS can now join. Just ask her to unmute and continue.
Sure, sir. I would like to welcome Dr. Anita Mahajan. I'd like to welcome Dr. Anita Mahajan. Thank you, ma'am, for joining us today. Dr. Mahajan is currently working as Director Health Services in Himachal Pradesh, and she's the first lady medical doctor to be appointed as Director Health Services from IGMC Shimla in Himachal Pradesh. She is also working as Project Director, State AIDS Control Society in Himachal Pradesh. I request Dr. Mahajan to please address the session. Ma'am, please.
Please ask her to unmute.
Ma'am, you are on mute. Please unmute.
I think she's still on. Yeah.
Yeah. Ma'am, you are not audible yet.
I think she needs assistance from someone.
Yes, sir.
Let's meanwhile go for another question from Dr. Anupam.
Yeah, we
Hello.
can.
Hello.
Yes, Dr. Anupam.
Hello, good afternoon. I am really thankful that they has arranged such a nice session. I just have a brief comment for Dr. Gopal, if he's available.
Yes, ma'am.
Dr. Gopal, are you there? Yes. Hello,
Yes,
Dr. Gopal. Actually, I really want to congratulate for giving such a nice talk on this topic. And I can really vouch for what you have all done in Himachal, because I'm also working there for such a long time. And I also want to add to Dr. Monica's suggestions that we should all be involving these people living with non-communicable diseases. And I was also part of the regional consultation of WHO at that time when they were all planning all this. Dr. Gopal, I just have one thing to, you can say it as a suggestion or just asking you that are we doing something for this continuity of care and continuum of care on non-communicable disease patients? Because as the kind of app you have made for this digital app you have made for NCD patients for the, at the population level. So if we have some kind of electronic health record system in which we can, the patients can be further referred so that we can maintain this continuity of care only, then we will be able to, the state will be able to reach that target of, having control of hypertension and diabetes of more than 50% of the cases. So what is your take on that?
Yes, madam. It is, the initial thought process, because I think you all were part of when we planned it in 2018-19. It was led from, by the experts. There is a system that, how we can move ahead. As of now, what record we are having? There is a risk assessment of individuals. Then what is their, the diabetes, hypertension, waist circumference, that the measurement is with us. Third one is whether the patient has been diagnosed or not. Now, next step is, the monthly follow-up. There is a system in place, but, it as of now, the follow-up part, which is monthly follow-up part, that is being done on by the health workers, by the ASHA worker, by the doctors. But the recording of that system is quite less. We recorded the data of follow-up of 1 year through a project in Shimla district for 5,000 patients for 1 year. Then we estimated the control rates among diabetes and hypertension patients. But the issue is, as of now, we don't have the health record. For example, the slip of the OPD slip, and for that we are working with Professor PC Negi, so that, but it will be huge, server space will be occupied with that. But as of now, or individual level, we can definitely see that whether he's under control or not, taking treatment regularly or not, and what are these risk factors, anyone who is having risk in his family. But ultimately, yes, the EHR of that kind per individual has to be created, which is a mammoth task. I think we can think on that maybe next one.
Dr. Gopal, I think Dr. Neeta has rejoined. So can we ask, after completing this answer, so can we ask her to join and address her? Yeah.
Okay, thank you, Dr. Gopal. Thank you so much.
Yes, Dr. Neeta, can you try now to join?
Now moving on to the next session. In this session, we will have a discussion for finalization of draft recommendation for Ministry of Health and Family Welfare of all states and union territories. This session will be moderated by Dr. Gupta and Ms. Srivastav. I request Dr. Gupta and Ms. Srivastav to please carry forward this session. Thank you.
So Dr. Radhika, you can start with the moderation.
Yeah. Thank you so much. So, it's been a very, very enriching discussion here, and I think lots of perspectives. But I think before we really deep dive, all credit to the government of Himachal Pradesh for really spearheading this whole initiative and showing the path to other states in the country. And in terms of the taking advantage of all the experts who are gathered here, I think this is a good opportunity for us to be able to understand what are viewpoints, and also from here look at what are recommendations and best practices that we can create these recommendations as an outcome of this meeting, and request other governments, other state governments, and even the national government to consider in their NCD programming. And so, Monica had spoken about three major pointers. One was multi-sectoral and multi-stakeholder working groups, meaningful involvement of people living with NCDs, and of course, strengthening digitization. I think we can open the floor to discussions on this, but Dr. Gupta, if you have any additional comments on how we should be like to go about it, we can do those. We also have some members from the Punjab working group here in the meeting, and so we can look at their inputs as well as to how they would like to see this being rolled out in Punjab. I'll just stop here because I think I saw Dr. Anita Mahajan reconnect from a director health sign up. So if she's there, maybe we'll take that opportunity to see if she can connect with us now.
So Dr. Anita, I think you can address us if you are with us. So we are waiting, or we can continue with the technical session, and you may join as and when it is possible for you to join. So I think there's an issue. So Dr. Radhika, we can continue with the technical session. So these recommendations she talked about, we'll be sending to Ministry of Health and Family Welfare and to all the principal secretaries, Health and Family Welfare of all states and UTs, because Dr. Gopal has done a commendable job in Himachal Pradesh. I mean, the whole team of the NCDs, they need to be congratulated. And we will like all the states to follow them. And I think it will be a good thing if participants, they can give us some suggestions which can be added as recommendations. So we have with us Dr. Sanjeet Singh Sodhi. He is part of the working group, and he is a very eminent cardiologist from Mohali. So Dr. Sodhi, will you like to suggest us some points which can be added to the recommendations?
I think practically, hello, first of all, good afternoon, everybody. Thanks for calling me here and making me part of this. I think most of the points are well covered. And so if there's anything, I would definitely send you a mail or on the WhatsApp.
Yeah.
But I think by and large, everything has been well covered.
Yeah. Thank you. Thank you, Dr. Sodhi. So we have with us Dr. Sandeep Gill. He is SP NPCDCS. So Dr. Sandeep, are you with us? Dr. Sandeep. And we have with us Ms. Nikita Sood. She's counselor with the Tribune School, and she is also part of that working group. So Ms. Nikita, can you add something to the recommendations? Suggest something to us.
Very good afternoon to all the dignitaries present here. Thank you so much, sir. First of all, I would like to thank CIFR and Healthy India Alliance for letting us attend such an informative sessions. And as Dr. Gopal Chauhan had made certain points, we have made note of all. And in our school, whatever we are doing with the support of Dr. Rakesh, I would like to make few points because he was talking about sedentary lifestyle and healthy habits. So we have started doing physical inspection of all the area we have in our school, and display of signage wherein we have mentioned that no use of tobacco under the premises, that also have been placed. Tobacco monitors, we have selected few students of our school and made them as tobacco monitors, and also we have started working on sensitizing different stakeholders with the help of our students only. So I think the basic work has been initiated, and also Dr. Rakesh, as suggested, so we have prepared a self-evaluation scorecard. I want you to note this point very specifically, that we have started giving the scorecard to the employees of the organization, and they have started evaluating and mentioning that how much problems they have faced, or whether they are in the use of tobacco, or they are aware of the people, they have relatives who suffer from diabetes or hypertension. So we are in process of collecting the data and working towards it. And that's all. I look forward to see cooperation ahead also.
And do you have a principal madam with you? Has she joined?
Sir, she joined, but in between she had a meeting, so she had to leave. She's very purposefully wanted to attend the full meeting, but she had to leave.
Okay, thank you. And may I ask Mr. Sanjay Seth if he is with us? He's a very important tobacco control enthusiast and a very senior colleague of ours. So if he is with us, he can just suggest some points. And Dr. Radhika, you can also invite members from the HIA Alliance also, if they can suggest some recommendations.
Sure. I think we'll go ahead with the first round of people that you have named, and then move to the Healthy India Alliance.
Okay. So I think my people, maybe they have left. We have Dr. Jaskiran. Dr. Jaskiran is with us. She's in the DHS Punjab, if she's with us. Or you can just scroll through the participant and we can just keep inviting them for suggestions, right? So Dr. Radhika, you can go ahead.
Yes. So I think from Healthy India Alliance, I did see representatives from Cypher. Cypher, of course, is there. We saw, I think, the NADA India Alliance and Pallium India. I'm not sure if they're still there or not.
So we can have an open session and anybody can.
Oh, yeah, sure. Dr. Rakesh, DHS.
Yes, madam, you are welcome.
Yes, yes, sir. Good afternoon, everybody.
Yeah, thank you.
Am I audible now?
Yes, yes, you are audible.
Yes, ma'am.
Okay. I have listened to all the dignitaries. Now I can express from, I am representing from Himachal. Keeping in view the increasing load of non-communicable diseases and the associated risk factors, the government of Himachal Pradesh has started a comprehensive program called Mukhyamantri Nirog Yojna since 2019 to address the issue in all ages as a life cycle approach. Key mandate of this scheme is risk reduction, health promotion, screening and management of non-communicable diseases with special focus on 18 to 30 age group, as already query raised by some person and a clarification was given by Dr. Gopal Chauhan just now, which are more vulnerable to the common risk factors like tobacco, alcohol, unhealthy diet and physical inactivity. Himachal has been regularly following the Government of India guidelines with innovations like integrated surveillance of 10 common non-communicable diseases, including cancer, diabetes, hypertension, deafness, blindness, COPD, epilepsy, and other cardiovascular diseases, mental illness, CKDs, and 15 risk factors and extension of the non-communicable diseases screening for 18 to 30 aged population, because if we can screen these age group people, we can save the other growing people who will be affected by these non-communicable diseases. And to prevent the risk at the later stage, we have to give main stress on this population. In Himachal, Ashas are visiting house to house for the risk assessment, and IEC, ANMs, health workers are doing the screening, and doctors are treating the patients, and the entire surveillance is ensured through the e-health card software in Anmol tablets, mobile phones at ANM levels. Till date, more than 60% population is under surveillance as a cohort. I thank all the ASHA, ANM, MOs, specialists, program officers, software partners, tech services, and NGOs in HP to support this initiative. We wish that Himachal will achieve the SDG target before the given timeline and will merge as a model state for NCDs prevention and control. My special thanks to the organizers for inviting me for this very important deliberation. I thank you all. Thank you.
Thank you so much, ma'am. Over to Dr. Gupta and Ms. Srivastava for the discussion.
So thank you, ma'am, Anita Mahajan. So I think you have done a commendable job in Himachal Pradesh, and we will request all the states, all the participants will give us recommendations, and then we will send to the Ministry of Health and Family Welfare and to all the principal secretaries so that they can also follow you. So thanks a lot.
Thank you, sir. Thank you.
Thank you. So, Dr. Radhika, we can just invite anyone who can just chip in for the recommendations, or we can share the draft with all the participants, and then they can send by mail or by WhatsApp, right?
Dr. Gupta, Dr. Rana Singh have shared a recommendation over the chat, please.
Yeah, Dr. Rana, you can just let
Okay.
us know about your recommendations. Yeah.
Yes. So thank you very much. I think excellent. I think discussion. I have experience now working with various states. We have heard what Himachal has done. So I think excellent work. Right now, the focus of Dr. Gopal and whole attention is focused on surveillance. So first of all, he wants to find what is the current status of all those NCDs. So this is his current focus. So I think, and the way digital health works for prevention to ultimate management, that is prevention, then diagnosis, then management, then monitoring and evaluation, palliative care, so many other things, rehabilitation. So all those elements. So first of all, I would request, and which I have been doing, even for all other programs, mapping is very important. So let's create maybe a group of experts who knows digital things also. Perhaps I am not an expert overall in digital health. So let's first map all those mapping, and then grouping of all those best practices or good practices in those different headings. Interventions for prevention, interventions for surveillance, interventions for diagnosis, interventions for management, interventions for monitoring and evaluation. So let's do that first work, and then I think that will really give us further understanding what are the different things are happening. Please do consider things from other countries also, especially low and middle income country, as I mentioned in the beginning. So I think once again, thank you. I don't have other recommendation, although there are many technical things. I am also part of, actually, I am a member of Himachal Pradesh Chief Minister Nirog Yojna as an expert member. So we remain in touch with Dr. Gopal and in a few other states also. So definitely, I think this is very important work. And in current scenario, digital health is really is very, very crucial. So at this stage, it's only this part. Maybe other things, it's a really very big thing. Thank you. Thank you, Dr. Bars. Thank you, Dr. Gupta.
Yeah. Thank you. Thank you so much, Dr. Rana.
Thank you, Aradhika ji. Yes.
Yeah.
So, Dr. Radhika, you can invite if any participant has any suggestion.
Yeah, so if there's anybody in the, I see we are still 27 of us, and I'm sure people will have any have inputs, or they would want to share experiences from their own geographies. We can look, we can discuss those as well.
Sure.
I'll request all those who are not speaking to kindly mute their microphones. So I had a very quick question to Dr. Gopal Chauhan, is that with respect to digitization and digital integration, I think when we talk about digital health, there are two aspects. One is, of course, building the capacities of the health department and the government officials, and across the spectrum, from the officers to the frontline health workers, building their capacities in being able to implement digital health interventions. And I think that's, kudos to the entire Himachal Pradesh team. I think they've done excellently well in that with the limited time and limited resources that are available. I also wanted to ask you on the other side. So for example, the beneficiaries for digital health is the community, are the people, and the level of digital literacy in the community is at varying degrees. So maybe in urban, semi-urban areas, it would be better. And of course, as we are seeing even in this meeting, anything which is digital is, it's dependent on technology and availability of internet facilities and the like. And given that, Himachal Pradesh is, a mountainous region and there are far-flung areas, what are the challenges that you have faced from the community side in being able to access digital healthcare?
Okay, am I audible, Radhika ji?
Yes, very much.
Yes, Radhika ji, when we started this work, we aimed very, very small. We did a pilot before application in the nearest block that is known as Sunni, which is around about 30 kilometers from Shillong. We have taken these things into consideration, that how to engage, communities. There is a system of, SMS to flow to the individuals, that, your digital health card has been created and you can access this thing, and they can download the application and they can see that, is there green tag, red tag or yellow tag, something like that. Yes. But what is happening on daily basis, we used to get 50, 60 messages and we ignore all those messages. The message has to be, follow up in a very proper manner. For that, it may not be ideal condition. What we have thought, the ASHA worker, for a ASHA worker, they are like a client. She's having a target of, for example, that she has to fill up the CBAC of 100 persons. She will be getting 10 rupees for each CBAC. Her target will be filled. May not be on other perspective. We only think that what is her target is. After that, if SMS is going to the person, the SMS simultaneously goes to the ASHA worker. She is having the line list of all those, persons, those who are there, those who are skin positive, those who are under treatment. Because she gets 100 rupees per year for follow-up of a patient if she is doing the monthly follow-up. If she is not doing 1 month follow-up in between, her 8 rupees something that is cut from her remuneration. It means that we have tried. This may not be ideal condition. The ideal condition will be total online system, where the individual can, put the queries on through some portal. 100% digital literacy, in Himachal Pradesh, it may be that 60% people, we say that in villages, the female, they are using Android phones. But still the condition is not ideal. Even we ignore such messages which are coming that you have to go for follow-up. Then the follow-up call is very important. We have tried to integrate it through the 104, toll-free helpline. But still there are gaps, and we need to think. If some technical partner, can help us for this, they are most welcome.
No, thank you so much, Dr. Gopal Chauhan, for really, giving that insight on how that micro planning is being done, and it is not just what we see here or in this meeting or on the PPT, but each and every step involves a lot of planning, micro planning, capacity building. So I really appreciate that. Thank you so much. I think Dr. Rakesh Gupta, over to you for the last comments and for wrap up and next steps. Dr. Gupta, you're on mute.
So thank you all for participating, and it has been a very nice discussion, and we have learned a lot from Himachal Pradesh, and I'm sure that all the SPOs attending and all the stakeholders in this on this issue, they will definitely send us recommendations, and which can be in turn sent to Ministry of Health and all the states and UTs. And I think the issue of the internet, I think it will not be there after we have 5G connections, and maybe the internet connections are through the satellite. So that issue will be over maybe within 2-3 months. But it is an excellent initiative, and till date, I think they are doing very well. There are some hiccups with the technology, but I think that they are able to overcome that. So thank you, Dr. Gopal. And now I'll request Dr. Bursa to please propose a formal vote of thanks for all those who have attended. Thank you.
Sure, sir. On behalf of Healthy India Alliance and Cypher, I am happy to deliver the vote of thanks for this meeting. We are grateful to all the distinguished experts who share their valuable insights on integrated digital approach for prevention and control of NCDs in Himachal Pradesh. Congratulations and thanks to Dr. Gopal Chauhan for leading this digital approach in Himachal Pradesh and creating an example for all of us. Thank you to all the state program officers who attended this meeting. A special thanks to both our guest of honors, Professor Monica Arora and Dr. Anita Mahajan for joining us today. Thank you, Dr. Rakesh Gupta, for successfully organizing this meeting. And thank you to all the dignitaries present today for adding richness to the deliberations with your active engagement. In conclusion, I thank all the team members of Cypher as well as Shraddha for support in organizing this meeting. Thank you, everyone.
Thank you all. Thank you.
So thank you all. So I think now we can leave, and the team HIA, that Hriday, may please stay for some time, and we'll stop the recording here.